I feel terrible. I think I might be coming down with something. My head is killing me. Maybe I'm hungry? No, I don't have an appetite. This isn't good. I should probably check up with a doctor.
Dr. Olson, nice to meet you.
Oh, hello, Mr. Van Doyle. What seems to be the problem today?
Well, lately I've been feeling very nauseous and have been vomiting on and off the past few days. I've been getting headaches quite frequently and I seem to be developing some sort of fever.
And how long has this been going on for now?
Well, today is the second day and my symptoms seem to be getting progressively worse.
Well, this could be any number of things, and as such, we'll have to take a few preliminary tests to help us diagnose your illness. Firstly, have you taken any overseas trips in the past month?
Well, I just got back from a trip in Vietnam under a week ago.
Well, by the sounds of it, you may have some type of tropical disease or illness. We'll need to take some diagnostic tests to gain a further knowledge and make a proper diagnosis.
Yep, that's fine. Whatever we need to do, I'm cool with it.
Okay, I'm just going to take a small sample of your blood and test for any viruses that may have passed through your bloodstream, as well as an additional urine test.
Okay, that's fine.
Okay. And there we go. Once these samples have been analyzed, one of my colleagues will call you back with your results.
Okay, thank you, Doctor.
Hello, Mr. Van Doyle. This is Dr. Olson. Your lab results are back from your diagnostic test. I'm afraid you're going to have to meet Dr. Barwell, a pathologist, back here as soon as possible, and it is very urgent.
Sure thing, Dr. Olson. I'll be in right away.
Dr. Bell, nice to meet you. Dr. Ross, nice to see you again. So, how did the results go?
Well, your diagnostic test came back with some pretty unpleasant information. Unfortunately, you have been diagnosed with yellow fever. You will require immediate hospitalization where you will receive intensive care and a further serum test to detect virus-specific IgM neutralizing antibodies.
What? How can this be? Where did I get yellow fever from and how did I get it?
Well, you see, the causative agent of yellow fever is Flavivirus fibricus, one of which is transmitted through the bite of an infected mosquito, primarily the Aedes aegypti, the same species of mosquito responsible for transmitting the Zika virus. In short, you were most likely bitten by a mosquito during your visit to Vietnam.
So what does this mean? Are there any further side effects to yellow fever?
So yellow fever has 3 different stages. Stage 1 being infection, where you receive flu-like symptoms consisting of headaches, muscle and joint pain, fever, flushing, loss of appetite, vomiting and jaundice. These symptoms usually last for around 3 to 4 days and is the stage that you currently stand.
Okay.
The second step is known as remission, where your fever and other symptoms start to fade. In this stage, many patients recover, but many others get worse within the 24 hours.
I see.
The third and final stage is known as intoxication. This stage only occurs for 13 to 30% of the diagnosed with yellow fever. During intoxication, problems with the organs may occur.
My organs? That's terrible. Dr. Olson, Dr. Barwell, please. Is there any way that we can treat this?
Well, unfortunately, there is no real treatment for yellow fever. All we can do at the moment is to treat the symptoms and relieve the pain through drugs such as ibuprofen as the body fights off the virus. If the disease gets to a more serious note, we will treat you through blood products in the case of severe bleeding and dialysis in the case of kidney failure. Though, other than in those severe cases, there is no surefire way to treat yellow fever.
This is terrible. Will it eventually get better?
I'm sorry, Joel. 50% of people diagnosed with yellow fever will tend to result in crippling sickness and death. Though, due to you coming to us in the early stages of the sickness, under the care of our specialist doctors, you should be better in the matter of a week or 2.
Is there anything else that I need to know?
Well, you will need to be hospitalized and under intense care, as yellow fever is a viral infection as well as an acute systemic illness.
Correspondingly, there are some things you need to know about your illness. Yellow fever is not contagious. It causes the death of the cells in the liver and can be organized into 2 classifications, urban and jungle yellow fever.
Okay. Thank you, doctors. I will remember this well and will do my best to stay methodical with my treatment.
Yellow fever virus enters its host through their bloodstream, where it can potentially damage the body's vital organs, most commonly the liver and kidney, and can result in death if your immune system cannot fight off the illness. Worldwide, there are 200 cases of yellow fever annually, where 30,000 of those cases result in death. There is a vaccination available to eliminate the risk of yellow fever. The vaccination begins to act 10 days after it is received, and should be received for travel to these areas. Thank you, and remember, always travel safe.